Hi everyone, this is Divya, and today we'll talk about vaccines, COVID vaccines, with Dr. Monica Gandhi. She's the professor of medicine and an infectious disease expert at University of California, San Francisco. Hi, Dr. Gandhi. Thank you so much for joining me. I won't take too much of your time, and I'll start with my first question, which is what are the common side effects of COVID vaccine, particularly in terms of, some people get flu afterwards, and there have been cases of blood clots as well. And are these vaccines safe?
They all have different side effects. I mean, basically, the mRNA vaccines mostly are just pain at the injection site and then can cause in some people fever, chills, headache, muscle aches, and joint aches that actually go away after a day. The blood clots that are very rare are associated with only the adenovirus DNA vaccines. AstraZeneca and Johnson & Johnson are examples. They're very rare. They're about 1 in a million chance, but it looks like the blood clots may have something to do with a rare reaction in some people. So warning labels have been put on those. But otherwise, they're actually very safe. So, they have been monitoring people after vaccines, and there are what are called breakthrough infections that you can get COVID after, but usually it's very rare. The people who are asymptomatic, meaning they didn't have any symptoms, you swab their nose, they can't pass it on to others because we've never seen someone after vaccination be asymptomatic and pass it on to others. I don't actually call those breakthrough because you're asymptomatic, you can't pass it on. That means that I think you're controlling the virus in your nose. But there are rarely symptomatic breakthroughs where people are symptomatic, but they're extremely rare. And the way I want to quantify that is actually very clear because the CDC, at least in the United States, is really tracking these. And essentially, of 87 million people fully vaccinated in this country, only 5,000 symptomatic breakthroughs. So that's 0.005%, so low. And then of those, most people just have mild symptoms because of our T cell immunity. Some people can get sick, but it's only 0.0003% hospitalizations. And then even rarer, 1/10 of that has died. So it's so rare to get it. That does happen, but it's very rare. And usually when it happens, they are mild infections.
So, are there any comorbidities or some conditions under which a person absolutely cannot get the COVID vaccine?
There really is no contraindication to getting a COVID vaccine. If anything, you are like, anyone who has comorbidities should get a COVID vaccine because they're more prey to COVID-19 severe disease. Only the AstraZeneca and Johnson & Johnson, I think, since all the clots have been in younger people, I think if anyone has a history of a clotting disorder, I would not give either one of those adenovirus DNA vaccines to someone who has a clotting disorder. And the way the European agency has decided to do it is AstraZeneca, they only give people who are older, above 60, because they've never seen a clot in an older person. AstraZeneca, though, in the UK and India, worldwide, it's being given to all age groups. So I would only hold off if I knew the patient had a clotting disorder, and I would give them the mRNA vaccine.
So, how long does the protection of the COVID vaccine last for?
I think that our immunity from coronavirus vaccines are going to be long lasting. I have 5 reasons for thinking that. One is that they actually measured in the trials what's called T cell immunity. There's antibodies which can go down over time, but T cell immunity, which are called CD4 and CD8 cells, they actually last a long time. And T cell immunity was developed by these vaccines, and there's evidence that T cell immunity from vaccines lasts a really long time. For example, there's a paper that measles vaccine T cell immunity lasts 34 years and counting. The second reason is because we had another severe coronavirus that caused terrible infections back in 2003 called SARS, and people have actually survived that, lived for 17 years, and they've looked at their blood and they have strong T cell immunity to SARS even 17 years later. Third is that, there's something called memory B cells. After you get a vaccine, you want that vaccine to go and make what are called memory B cells that go in your lymph nodes. And they produce B cells that every time they see the virus in the future, they'll come out, produce antibodies and kill that virus. There was a study from the UK that showed that 7 weeks after vaccination, you do make memory B cells that biopsied lymph nodes, and they made really strong germinal centers and memory B cells. And memory B cells can protect you for life. There was an influenza paper from the 1918 influenza pandemic that 90 years later, people had still memory B cells that could fight the virus. And 90 years later, if they'd been exposed when they were 3 or 4. And then the final reason is coronavirus, though it looks like it's mutating a lot because we have a lot of cases, doesn't mutate that fast. It's actually influenza mutates much more quickly, but coronavirus has what's called a very strong proofreading mechanism. So those reasons make me think that once we get it under control, we're not going to need boosters in the future. That's my hope.
Why in some of the vaccines you need 2 doses, and why in, like, for example, in Johnson & Johnson, you would just need 1. And
yeah, exactly. So basically, the mRNA vaccines were made as a 2-dose regimen. However, there is really great data that 1 dose is likely at least 80% effective, maybe even up to 90% effective. However, they were developed as 2-dose vaccines, and that's what we decided to do is give them as they were developed. So we are giving 2 doses, but after 10 days after your first dose, you likely have quite a bit of immunity. The Johnson & Johnson was a 1-dose regimen because it just 1 dose produces really strong immune responses, both antibodies and cell-mediated immune responses that go up over time. Actually, probably the strongest response from Johnson & Johnson is between 2 and 4 weeks. And they only studied it out to 2 weeks to ask if people got cases. So it looks like it's a very immunogenic, or produces a strong response, and 1 dose is all that people are going to need. And it's usually 2 weeks, we say, after the second dose, or of either mRNA vaccine, or 2 weeks after the first dose of Johnson & Johnson, that you are fully protected.
Can you comment a little bit on the AstraZeneca one, if you're familiar with it?
Yes.
Yeah. I don't know how much you're familiar with the Covaxin, which is like the
yes
local one, but like if you can illuminate a little bit on the vaccines in India.
Yeah, so you're right. India has 2 major vaccines, AstraZeneca or Covishield, called there, and then Covaxin, the Bharat Pharmaceuticals homegrown type of vaccine. And the AstraZeneca is just like Johnson & Johnson in that it's an adenovirus DNA vaccine. So there's a virus on the outside, there's a piece of DNA on the inside, and it actually produces very strong T-cell mediated immunity. It protects against severe disease extremely well, even across variants. And in the UK, it's been very successful, meaning they have rolled it out to they have 32 million people vaccinated right now, some with Pfizer, but at least 20 million with AstraZeneca, and they have not had a problem, and they've had strong immune responses. So AstraZeneca, I think, is a really good vaccine. It may not protect as well against mild disease with some variants. The Covaxin is actually an inactivated virus, so kind of a whole virus, but inactivated, also 2 doses. And we don't actually have the full publication of its phase 3 results. We do have good phase 1 and 2 results that shows us that it does what we want it to do, which is to produce both antibodies and strong T-cell immunity. So that's a good sign. And then they have a press release on its efficacy. It looked like it was at least 81% effective, but efficacious in the trials, but I am waiting for the full report. On the other hand, they did test Covaxin against the B1617 variant, which is the variant circulating in India right now, and it worked fine, and that's a good thing. So I do think that the combination of Covaxin and Covishield are good. It's just that India clearly needs more vaccines than what they have now. And to me, that means that we need to think about getting more mRNA vaccines. The world needs to produce more vaccines, in my opinion, and donate them to.
Is it fair to actually compare these vaccines based on their efficacy rates, or, based on the fact that one is single dose and one you need double dose, and like so on?
Yeah, I mean, that's the other thing about these vaccines, is that what gets in the media is sometimes just what happened in the clinical trials. And the way that I think about it is the word is different. The word for how a vaccine works in a clinical trial is called efficacy. That's a principle of epidemiology. The way it works in the real world is called effectiveness. And these vaccines are showing us that whatever we saw from the clinical trials, it's even better in the real world. And that, I think, is really amazing, because there was a study yesterday from a big healthcare system across the United States, the Mayo Clinic Health System, that the Moderna vaccine is 98.6% effective, the Pfizer 97% effective. That's actually higher than the 94% effective rate in the clinical trials. Same thing with Johnson & Johnson. We've had 8 million doses administered in the United States, and there hasn't been reports of breakthrough infections, or if they are, they're rare. So I do think that they're likely in the real world are even better than they've shown in the trials. So sometimes when we quote those numbers from the trials, 66% for Johnson & Johnson, 81% for Covaxin, we are rolling them out to millions of people. And it's better to see what the real world data is, and they are looking better.
So there's no way to basically compare the AstraZeneca or the Covishield versus Covaxin. Both of them are good.
They, at least so far, and this is the problem with India, right? And part of the reason this is happening with this terrible surge, only 8.7% of Indians have been vaccinated with their first dose at this time. And so at least in India, we are not seeing symptomatic severe disease breakthroughs, meaning even though there's a lot of clearly circulating virus, people who have been vaccinated are not coming back to the hospital because they get sick. And that, you can say, is a combination at this point purely of Covaxin and Covishield. And they're being put to the ultimate stress test, which is a lot of cases in India, and still not seeing people come back with severe disease. So that's as good of data as you can get that they're likely working. The problem in India is we only have 8.7% first dose.
So, one question is that if somebody has had COVID and if they have recovered, do they still need the vaccine?
Well, this is a great question. There are now at least 8 papers that show that if you've had COVID, one dose of an mRNA vaccine gives you the same level of antibodies as 2 doses is in someone who has not gotten vaccinated. The FDA has not changed their recommendation, but if I were the FDA, I would say anyone who's had COVID before only needs 1 dose. In terms of them needing the vaccine at all, that's a very, very important question. Right now, we keep on seeing what are called reinfection studies from both people who have recovered from COVID and people who've had the vaccine. And the rates of reinfection seem to be extremely low in both groups. There was a study from Israel that compared the vaccine, this was just in preprint yesterday, compared the vaccine to people who've had the COVID virus, and they had the similar rates of not getting sick, of not getting infected again. So right now, the US is recommending that those who have had natural infection get 2 doses, but I would go down to 1 dose, and I'm not sure that they need it at all. And I think that kind of thing is going to sort out with time in areas where we see that we should decide if we know someone's had COVID, I would prioritize my vaccines for people who have not had COVID. I personally do not think anyone in India right now during this public health crisis who's had COVID before should go and get a vaccine. I think they do need to be prioritized for people who have not had COVID. And then later, we'll have longer and longer studies of the duration of natural immunity, and there can be a decision if they need a booster in the future. But the data is showing us right now that having natural infection is as protective as getting a vaccine.
So, is getting vaccinated a safer way to build your protection than getting infected?
Yes, if ideally, because even though COVID is mild in many young people, and children also have very low rates of severe disease, we have these vaccines now, and it would be wonderful if people didn't have to go through the symptoms of COVID-19, which, even if it's mild, can be really long. People can last a long time and people don't feel well. In an ideal world, again, and this is meaning ideal world, I'd rather everyone get a vaccine worldwide than ever have gotten COVID. But at this point, many people have gotten COVID, but I would rather someone have the safety of a vaccine than have to go through COVID.
Can someone get vaccinated while they're sick with COVID?
Oh, that's a very good question. So when you are sick with COVID, often have very high immune responses. You have high antibodies, you have very revved up inflammatory system, T cell immunity. And to be honest, I would not get a COVID vaccine in that setting because it then induces more immunity, and you may have a very rare reaction called enhanced antibody immune response. I don't think that hasn't been documented, but most people have not gotten vaccines during COVID. I would definitely wait. The CDC says right now, wait 3 months. I would even wait longer after COVID based on what we were saying, but I would not get it in the context of COVID.
If somebody, is going through just the normal flu, can they get the COVID vaccine or they have to wait?
That's a great question. I think that, it's definitely safe to get the COVID vaccine. Yeah. The only reason that we are just so eager for people to get the perfect immune response to COVID, and we say, don't give it around other vaccines or don't give it if you're sick, is this kind of theoretical question. If you're sick from something else, could that decrease your immune response to the vaccine? This is completely theoretical. There's no evidence for it. And in this setting of limited vaccines, especially in India, anyone who doesn't feel well but doesn't have COVID, I would give them the vaccine. Just get the vaccine out.
And if somebody gets infected, let's say after the first dose, then, how long should they delay their second dose for the vaccine? How long they should wait?
Yeah, it's a good question. I would wait 3 months, kind of based again on the CDC guidelines. Because then you've gotten COVID, now you kind of start the clock over again and then wait for your second dose for 3 months.
Okay. So is it like true for, it's irrespective of the kind of vaccine, right? It's just
irrespective of AstraZeneca, or yeah, exactly, or Covaxin, anything.
And, what are the chances of somebody getting COVID after their first dose of vaccine and then after the second dose of vaccine?
It depends on how long you wait. So meaning there have been people who have been infected after their first dose, but their immune system hasn't had time to kick in. Usually by 10 days after your first dose, you're about 80% protected. And then again, after 2 weeks after your second dose, you're really 100% protected. So I would say don't expose yourself to any risks, or being around anyone, or, not just too much exposure for at least 10 days after your first dose, because most of the time that people have gotten COVID between their first and second dose, it's very close to their first dose.
So you mentioned like after 2 weeks, it's full protection. So my next question was actually about being fully vaccinated. When is a person considered fully vaccinated? So is it true for all the vaccinations then that the full immunity is after like 2 weeks?
It's true after the second dose that at 2 weeks you're considered fully vaccinated. The one thing I'd say about Johnson & Johnson one dose is that when you look at the phase 1/2 trial data, they actually look like the immunity went up even more after 2 weeks. So immunity went up to 2 weeks, then it even went up higher from 2 to 4 weeks. So I am advising, this is a personal thing, advising my patients that after the Johnson & Johnson vaccine, don't consider yourself fully vaccinated until 4 weeks. And that was sort of based on my read of the literature with the immune response. But the official position is 2 weeks after the dose.
And that also goes for the AstraZeneca.
And
Covaxin, and now the new one, which is in India, is the Russian vaccine.
Sputnik 5, yes. Yeah, same thing. Sputnik 5 is also a 2-dose vaccine. And that is considered full protection after the second dose 2 weeks after.
So should one continue to wear mask and practice social distancing after their first dose and the second dose?
Well, yes, not, it's kind of a nuanced question in the sense that vaccinated people, fully vaccinated, can be around each other without mask or distancing. And also you're very unlikely to transmit. There's a lot of data showing us that now. So you're unlikely to transmit it to like someone in your household, like a child who is unvaccinated. But right now we're still in this situation where not everyone in the world has managed to get a vaccine who wants a vaccine. India, especially, obviously, with the only 8-9% first dose rate. And so you still want to mask and distance when you're indoors, around others, even if you're vaccinated indoors. The CDC just changed their guidelines today. This is April 27th, that you don't have to mask outside if you're vaccinated. And I think that's fair because outdoor transmission is very low. But we still want to maintain this until we get the levels of virus very low, which we're achieving in many places in the United States, including California. We still want to do our mask and distancing for a while longer. And certainly in India, it's going to take a while until we can get that population vaccinated. So the value is, in a way, just going out in public. Number one, it's also respectful that other people have to mask and distance who haven't had the vaccine. And then again, symptom breakthroughs are very rare. But in a situation like India, where there is so much circulating virus, there are such high cases at the moment, I would want the vaccinated person to keep their masks, keep their distancing until more people get vaccinated and the cases get driven down, just for that rare symptomatic breakthrough. And so, yes, masks and distancing is still important until we can get to a greater level of immunity in India or anywhere.
So, once somebody has had their COVID vaccines, both the doses, can that person still infect other people, even though, they might not be getting infected themselves?
That when we looked at the clinical trial data, that answer was, we don't know, because they did in the clinical trials, they just swabbed people and didn't look for asymptomatic infection. They only swabbed if you were sick. However, there's now been 10 studies, because it's been, since December, it's now April. We have many studies that show that vaccines do lower the risk of asymptomatic infection, of your ability to transmit to others. And in fact, the largest study is from Israel that looks like you have a 94% reduction in asymptomatic infection, which would mean that you can transmit to others even when you don't have symptoms. So I think it's actually very hard to transmit to others after you've been vaccinated. And that data is really accumulating now. And I think it's why the CDC said that you can be around unvaccinated people who are low risk after you're vaccinated.
My other question was about the variants, actually. So since there are so many variants going around, and especially there's a double mutation and triple mutation, the one which is in India, the Indian variant, actually. So do these vaccines, specifically, if I were to refer to Covishield and Covaxin, I mean, all those vaccines, do they protect against the variants as well?
They do, actually. I mean, the way to think about that is just very simple. The variants, which there's been a lot of talk about them, there's antibodies, arm of the immune system, there's T cells. T cells form responses across the spike protein in a very complex way. What I mean by that is, like across the spike protein, there's T cells that form across 52 parts of the spike protein, or T cells that form across 23 parts of the spike protein. So it's a very robust, multiple T cells latch on and kill your virus. And so cell-mediated immunity, which protects us from severe disease, works across all the variants from all the vaccines. And so I don't think that variants are going to be our issue in terms of getting to herd immunity. I think our issue is going to be getting people vaccinated enough. But I think we need to stop worrying too much about the variants. And also Covaxin, the B11617, they've already looked at it with the Covishield with Covaxin, and it works.
This is an important question, which is, does the vaccine actually prevent, deaths and hospitalization due to COVID, or it prevents the infection altogether?
Both. So it definitely prevents severe disease, hospitalizations, and death at very high efficacy rates, 100% efficacy, effectiveness, actually, in a Pfizer study that was published on April 1st in 44,000 participants in Pfizer across the world. And 100% protection from severe disease, even with the B1351 South Africa variant. However, even symptomatic, it's about 95% protective. And then even asymptomatic and just getting infection in your nose is 94% protective in the largest study that was just published from Israel. And so all of that data put together, it means it stops both disease and infection, and getting even mild infection or even asymptomatic infection.
While somebody is actually taking the COVID vaccine, the entire course, the first and second dose, can they take other vaccines at the time as well?
Theoretically, yes. For example, childhood vaccinations, we give them multiple at once, so we don't have to keep on giving shots to the child. We even have combination vaccines like diphtheria, pertussis, and tetanus, so we give them all at once. The reason that we are not advising that like strictly in the guidelines is we just don't want anything to interfere with the response, but there is no theoretical, honestly, reason to think you can't give another vaccine at the same time with COVID.
What is the youngest age right now to get a vaccine?
Right now, the youngest is 16. Pfizer is approved down to 16, and Moderna is approved down to 18, and so is Johnson & Johnson and AstraZeneca. So it is only down to 16 as the lowest. I do want to say that this New England Journal, there was a paper that showed that among 35,000 pregnant women who reported in outcomes to the CDC with mRNA vaccines, mostly some Johnson & Johnson, everyone had no major adverse effects, no adverse effects to the fetus. So we are recommending these vaccines during pregnancy and also during breastfeeding, where it's been shown there's good antibody transfer to the baby. And there's also no link between infertility and vaccines. That was a myth propagated on the internet, but there's simply no link.
And my last question is, how can we get towards the end of the pandemic? Is vaccinating each and every individual, is that the answer?
We don't need to vaccinate every single individual. We need to vaccinate enough so that the cases come down to very, very low levels and everyone else is protected because they're not exposed to the virus. That's called herd immunity. And where do I think that magic number is? Looking at modeling from Israel, the UK, even the US now at this point, I think it's going to be about 65 to 70% of the population. So it's certainly not everyone. We don't even need to get down to all children, which the vaccines are not approved of, as we discussed, because I think we're going to get to herd immunity faster. Why? Because these vaccines are extremely effective, which makes you go to herd immunity faster.
Yeah, thank you so much for all your time.
Okay, thank you so much.
Well, this brings me to the end of this video. Thank you for watching. If you liked the video, subscribe to my YouTube channel, Quick Mommy Hacks, and follow me on Instagram.